Hello everybody from Firefly Hollow. So if you guys haven't figured it out yet, I'm Michael. I'm one of the new practitioners here amongst the team, and right now I'm actually working with a great acquaintance to everyone here, as well as a friend, Emily. If you know the receptionist, Vicky, she is the wonderful lady you guys see every time you walk into these beautiful doors, and this is her wonderful daughter that is so kindly getting some treatment with Electrons Plus, one of the new therapies that are provided here in York County exclusively through Firefly. If you guys haven't seen this, and if you haven't got into it by any means anytime soon, this is a great way to kind of check it out. Right now, Emily's just getting a little bit of work done on her trap, and we're actually going to do a little bit of the vagus nerve with her today. And she hasn't yet experienced it, so you guys are going to be experiencing her reaction for the first time, as well as her own reaction, as well as me getting to experience how she takes the stimulus, okay?
Can you tell us about what the vagus nerve is and what it does?
Yeah, so your first cranial nerve is the vagus nerve, okay? So that's one of the most important highways of the body. It's one of the first connections that go to the rest of the body that controls many systems, as well as regulates a lot of things in the body. It's not limited to, but respiratory function is huge, as well as your circulatory function. These are all things that are included with normal healing if you've done anything with your wellness. Everybody wants great circulation, great respiratory work done on their body, as well as, on top of that, just to feel good. So if you haven't done anything for your body, or specifically, let's say, if you're doing work psychologically for your body, the vagus nerve is very crucial element to sustaining a lot of things within yourself. So if we've done vagus nerve work, and let's say we haven't done it first, and let's say, Emily, you're coming in for your first session, let's say for whatever reason you have stress or maybe some anxiety with you, if we work on the vagus nerve after a good bit, your body, after getting vagus nerve work done with Electrons Plus, is going to put you into a parasympathetic state of rest, and it's also going to give you some alleviation, if not a lot of alleviation, from these symptoms. So if you are experiencing that, and we go into the actual vagus nerve, just to kind of give you guys a little sample of what to expect, right? Obviously, if you've seen some work with Electrons Plus, you'll know that we can get tissue to jump, we can get it to move, right? This is all part of the electrical stim, right? All I'm doing is moving and gliding my hands to where we want to prioritize our healing today, okay? So with the vagus nerve and everything, Emily, are you ready?
Yes.
That was
so
exciting.
really, right now, you have a Electrons Plus box over here set up, and we have a pad set up under Emily, so she's getting the
PEMF benefit.
PEMF benefit. Yeah. And then you have a mat underneath you.
I have a grounding mat with my awesome white socks, if you guys can see. And the really cool thing about this is, depending on where I put the actual pad itself, so as you saw it was down by her leg, that flow of electrons doesn't only limit to where we're working here, right? So if the flow of electrons are going from a very far distilled away portion of the body, we're actually treating more than just the spot we're working with today, okay? So residual benefits are great, but what we're going to focus on for today's live is the actual vagus nerve, right? So if you guys were tuning into the podcast that we had with Kara just recently, we talked a bit about that, but here's a really good demo that you guys can see up close. If you didn't get a chance to check that out, or maybe you didn't see it and you were listening to it on a podcast network, we can see here that by just kind of stimulating very closely, right now I'm not really actually applying too much of the stimulus, I'm using my other hand here to kind of pair it a bit. We can see that we're getting electrical stimulation to some of the major stabilizers of the neck, but most importantly, you can actually feel, Emily, you're definitely going to feel a lot of it, you can feel where the vagus nerve is being stimulated due to a couple things. You may be able to feel it in your shoulder, you can feel it in your eardrum here, Emily, right?
I feel it in my ear. Yeah.
Ear, right? So very good indicators that we are hitting the right spot. Now, if I were to take my right hand off, you can actually see the pulses begin to increase, and you'll see your head start to shake. Right, so now we're really applying the full stimulus that we are allotting for this session. And if we really work towards it and we can actually access more so the shoulder, we can go down to areas of the brachial plexus, in which case, Emily, you're going to be able to feel this in your shoulder, maybe even down to your hand. And if you hit the right spot, depending on the spot, which might take me a second here, so bear with me, everybody, you'll be able to see, here's a rear delt flexion going on. You see a little bit of the lateral anterior delts going, right? But what we're doing is healing more than just one spot, like I said earlier. Now, when we work with that vagus nerve, obviously we don't just do one side. If you want to, Kara, you can swing around to this side. We work both ends because who wants to not have an even body, right? So working both sides is very, very crucial because we want to make sure we're covering all of our bases. And just like I did with the other side, we're going to just slowly load into it.
And what are you experiencing, Emily? What does it feel like?
There's a lot of involuntary twitching.
Yes.
And just kind of, yeah.
What does it feel like outside of an involuntary twitch? It might feel like maybe like a pin and needle, but I don't want to take your response. What does that feel like?
I do have that pin and needle space in a few spots.
Mm-hmm.
Yeah. Yeah, that's a little bit of that tingle.
Mm-hmm.
But not any kind of real major discomfort.
Yeah, no pain or anything like that?
No.
Good, excellent. All right, so when we're working with stimulus like such as Electrons Plus, where we're applying electrons in the body, and whenever we're essentially selecting where we want to really focus our healing, our real goal is to obviously not cause a lot of discomfort in certain areas that might need it, but in areas such as this where it's a little bit smaller, maybe there's not a lot of crazy tissue compared to maybe the legs or other distal parts of the body, we just want to make sure that everybody's comfortable in this scenario because it is a lot to get into early on. But for Emily's sake, she's a champ. She's doing this her very first time. It's kind of like getting a tattoo sometimes if you think about it because you're doing something new. However, there is no pain that is associated with it. You'll just get a little bit of that tingly feel. You'll definitely feel a lot of the tissue being pulled around. But overall, for the most part, you're not going to be experiencing anything painful from this actual therapy, which makes it very unique to actually watch and see.
So what can PEMF and Electrons Plus work with? What types of treatments, so type of clients do you work with, and type of symptoms?
Yeah, so the cool thing is it's a very broad perspective of what we can actually work with. So when it comes down to the individual, you could be an athlete, you could be a normal non-athlete, just a regular everyday individual looking to improve your health, or perhaps maybe you're someone who's struggling with health and wellness, and maybe you need a bit of an extra boost. So when it comes to Electrons Plus itself, this is a very, very efficient way to actually refuel the body, right? So your cells, while they are very vital when it comes to nutrition to really get the energy that you need, this is also a good way to kind of cheat sheet that energy and essentially refuel your cells so that way they're at a very healthy millivolt level and they're gaining essentially the ability to give you that energy over a long period of time. So if you come in for one session, right, and let's say you don't get those full effects, but let's say you came in for the third session, once your body gets this good homeostasis that we're really looking for with most things that we do when we try to implement something into our wellness, you're going to be feeling those energy levels increase, and on top of that, you're going to feel it last a lot longer. Now, if you are somebody who's looking for maybe healing, maybe you had something like an injury, or you're having a disruption within the body, perhaps, maybe you're just getting a weird kind of pain feeling. For example, like Emily, you came in today, you have rhomboid pain, right? So we did a little bit of a treatment protocol for the shoulder that includes the rhomboid to help alleviate those problems. This is a great therapy for you to really get into because it's really quick, it's efficient, and it doesn't take too long to actually get that response that you're looking for. Now, if you don't get your benefit within the first session, that's okay. Most people can if you're really lucky, but if you're not, that's okay. Usually you're going to experience those benefits after 2 to 3 sessions, and by that time, that homeostasis really kind of takes in the new wellness program that you're doing. Perhaps it's Electrons Plus. It's going to really fuel your body to do the right things that you need to do. So what we're going to do is just kind of work on the feel-good area, which I told Emily about earlier, which is the shoulders one more time. And all we're going to do is change up some of the parameters, okay? So I'm going to come back here. Sorry, care if I get in your way. And we're just going to kind of tailor up everything with her shoulder.
And what kind of modalities do you usually see this paired with?
So a lot of modalities that you'll see this paired with are very, very common ones. So chiropractic was a good one that we talked about just earlier because if you haven't figured out that we do have a chiropractor on site here at Firefly on Wednesdays, right? So we had Emily check our chiropractor out, and that turned out to be something that was efficient. And this is a good thing to kind of bring into Electrons Plus, right? If you're having something where maybe you're doing training for something, if you go to a chiropractor, this is a great way to increase the efficiency of what that practitioner is trying to do, and it's going to get you pretty much in the place you want to be a lot faster compared to if you weren't doing something to pair with it, if that makes sense. All right. So in your case, you're really lucky. You had a chiropractor visit on Wednesday, and now you're on the table with me for a Friday. It's really cool to see.
Planned it or something.
Yeah, it's almost like you planned it. How ironic. Now, that's not limited to chiropractic. You could be someone who's maybe going to physical therapy and just needs an extra boost. or perhaps you're working with a massage therapist or a Reiki specialist, anybody who works with any of these kind of modalities. It's not limited to these, obviously. This is a great way to increase the efficiency of those basic programs that are being run through to you, so that way you can increase your healing levels as well as your wellness overall. So here right now, as you can kind of see, we're kind of just tailoring up everything. So Emily, you pretty much hit 30 minutes almost, so we did a good full 30-minute session. Right now we're just kind of calming the tissue back down with low levels, and it's going to feel pretty good. Yeah. And by doing this, what we're doing is just relaxing that tissue once more, making sure that everything's really tidied up and that she's feeling very loose and relaxed after her session.
So I don't know if you guys, like, you can see your arm is twitching from the Electrons Plus.
Mm-hmm. Yes.
How does that feel?
This part feels good for sure. I love this part.
It feels pretty good.
Yeah.
It's kind of, like I said, it's a little weird to not have control.
Yes.
But that's, you know.
Well, if you've ever used a TENS unit, it's similar, but not.
Exactly.
Yeah.
Tell us, what's the difference between this and a TENS unit?
Yeah, this is a good question. So with the TENS unit, right, you're looking at a very portable device that you can get that pretty much goes home with you. You may get prescribed them by doctors, physical therapists, in a way to help, whether or not alleviate pain, but increase some stimulation to the areas that we're trying to heal. Now with the TENS unit, right, this is going to be, like I said, something that you could be taking home with you. You have patches that you put onto your body to selected muscle groups that you believe that are necessary to be recovered. The only issue is with the TENS unit, you're not able to fully know if you're hitting the right spot. You could be in the spot you feel like is in pain, that might be helping, but really maybe you have a weaker area of the body that needs to be assessed by an actual practitioner, such as myself. That is really what you need to gain full benefits of health, right? So if you are using a TENS unit, same thing, right? We're looking to stimulate the body, but it may not be at the right spot. It also may not be strong enough to effectively stimulate the tissue to do what it needs to do for recovery. And lastly, it's certainly not going to feel as good as this. If you've ever used a TENS unit before, there's areas of the body where it may not have the cleanest connection. It may not feel as good because there is some pain or maybe a little bit of a stingingness that could come with it. Here, there's zero pain. We have zero stingingness. We're not making any shocks. As a practitioner, I'm very, very clinical with making sure everybody's comfortable, so that way there is nothing like that happening of the sorts during a session. And the most important thing is that we're just doing exactly what the patient or client really wants in their session. We're making sure that they're fulfilled to their highest, as well as, you know, feeling refreshed when they're done.
And then anything else as far as how you schedule this, how often you should, anything else you want to say about this modality?
Yeah, so when it comes down to scheduling, right, obviously the best way to do it, if you are seeing this from Firefly's live broadcast, you're going to want to just go to the website and go under appointments, and you'll find there's a small little section that says Training Electrons Plus. Right now there's just 3 slots for Electrons Plus at the meanwhile. Click either the 30 to 90. That's a great way to get started, right? Book a session, okay? Now, when it comes to how many times you should be doing this, well, there's really a 48-hour window that I would always suggest in between sessions. So if you're somebody who maybe just had a surgery, or you're, you know, in this case, like C-section, right? That's a great kind of thing to look into. If you had a C-section, you just gave birth, right, childbirth, you would come in and maybe do some 48-hour in-between sessions to help recover a C-section scar, right? Or at least make it heal 10 times faster than it would on its own, okay? So if you were just somebody coming in for overall health benefits, similar to massage therapy, you could come in once a month, maybe come in once a week or every other week. It's all really down to what you think is best fit for you, as well as what is suggested through myself, the practitioner. However, you don't need to be limited or, if anything, restricted to certain days that you would come in, outside of course, being it's a Friday that I'm here. But you have a lot of autonomy when it comes to this version of healing, and it's really, really nice to see.
Cool.
Very cool. It's very exciting. Emily, you have been really, really great. Thank you for being a stellar patient today.
I think she looks really relaxed.
Thank you.
You look like you could fall asleep.
I'm working on it. Just keep doing your thing.
Hey, I'll keep going. I've got it.
Good, man.
Yeah.
Well, thank you so much, Michael.
No, thank
Appreciate
you.
it.
Yeah, I'm very happy to be here. It's a great practice. It's also a great family of individuals that come collectively together to essentially give people what they're lacking, whether it's knowledge, whether it's overall wellness. This is the next step for you to invest in your recovery, and I'm really happy to be a part of that with Electrons Plus here at this practice. So thank you guys for tuning in. This has been a treat.
Bye.
Bye, everybody. Say bye, Emily.
Bye.